So we're going to have an overview of the mental health nursing from my colleague Peter Donnelly, who's the program director. So Peter, if you want to
Hi, good
unmute
afternoon,
yourself.
folks. Yep, hope you can hear me here. So, hi, good afternoon, folks. Peter Donnelly is my name. So, before I dive into mental health nursing, I just wanted to talk for 2 seconds about inclusivity. So, the School of Nursing and Midwifery and Health Systems, and UCD as a whole, strives to be a model of inclusion. We respect and value student diversity. Our learning environment is designed inclusively so that it can be accessed, understood, and used regardless of student background, personal circumstances, age, or disability. So it's really important to know that. UCD is a university for all where diversity and inclusion is woven into the fabric of all that we do. Students are encouraged to approach staff to discuss learning needs, and any information disclosed will be treated with confidentiality and respect. So just important for you to know that. So let's discuss what is mental health. Well, mental health is a way to describe the state of one's mind, feelings, emotions, and coping. It's the balance between social, physical, spiritual, and emotional aspects of life. Mental health impacts on how we manage and make choices in our lives. And mental health is far more than just the absence of mental illness, and it has to do with many aspects of our lives, including how we feel about ourselves, how we feel about others, how we are able to meet the demands of life, what provides us joy and purpose, connection, and a sense of being at ease with the world. As you can see, it's about just living life to the fullest that you can live it. Okay, but what and how will I learn as a mental health nursing student? Well, you'll learn theory and skills in UCD, practice it in our clinical skills labs with your lecturers and clinical skills tutors, and put it into practice for real in your clinical placements from first to fourth year, where you'll interact with patients and clients and be assessed by qualified nurses. So, two questions. What does the program look like? What are the subjects? And do students of psychiatric nursing train as one group, or are we integrated with other nursing and midwifery students? So, if you look on the right hand side here, you'll see under BSc Nursing Mental Health that for each stage or each year, you have specific modules of theory and clinical practice, which are dedicated to learning about mental health nursing. So in stage one, you have foundations of mental health nursing A and B, followed by clinical practice. And in stage two, you have specialist care and mental health across the lifespan and clinical practice, and so on. And then, as Catherine and Suja have already said, you have shared modules which you will take then with the general and the children in general, and in some cases, the midwifery students also. I won't repeat them, but you can see that there are scientific principles and to do with nursing concepts and values and pharmacology, etc. The other thing that's important to know is that you do have the opportunity for electives in years 2 and 3, and the electives are anything of your choosing. So that could be a language or archaeology or art. It's totally up to you. And like the other programs, you also have the opportunity to study abroad. In the case of mental health, we have a relationship with Turku in Finland where you can go. So, where are the clinical placements? Well, again, we have arrangements with St. John of God Hospital and with the HSE. So, if you're based primarily in St. John of God, you'll get your training in the St. John of God Hospital and in their related community services, which are really broad and right across Dublin. If you're primarily with the HSE, you'll have places right across the Dublin and healthcare region, Community Healthcare East, as it's known. When we talk about placements, we talk about core placements and specialist placements. In the specialist placements, that may include coming into contact with clients, for instance, who are mainly adolescents, or it could be a placement in the forensic services, such as the Central Mental Hospital. It will be working perhaps with intellectual disability services, in care of the elderly services, or with people who are suffering with eating disorders or with addictions. So it's placements across an array of sites which are all audited and all approved for nurse training by UCD and the Nursing and Midwifery Board of Ireland. So, what's mental health nursing about? What will I learn, for example? Well, you will learn the skills of how to communicate, empathize, and support people who are depressed, or perhaps hearing voices, or feeling anxious, or worried, experiencing body images disturbances or eating disorders, or people perhaps who are self harming, abusing drugs, feeling suicidal, experiencing mood swings such as depression or feeling euphoric. So you will learn the art and the science of collaborating with people in achieving recovery. And recovery is a personal journey for each person towards leading a meaningful and fulfilling life as determined by them, even though they may still experience some symptoms of mental illness. What the program includes: a deep understanding of the science and art of nursing those in distress with respect, with empathy, knowledge, and compassion. You'll learn transferable skills that will teach you how to manage yourself and others in times of crisis. You'll learn reflection, self awareness, and how to care for your own mental health and that of others. You'll interact with people of all ages using honed communication, de escalation, psychological, and interpersonal skills. Incremental professional training leading to a world recognized qualification. So these are some of the placements and possible sites that you could see. And those are some of the experiences that the people you're looking after may be feeling or suffering. So stress and grief and depression and so forth. So the question, will mental health nursing change me? Yes. We are all changed by life experiences. So you will be challenged, assessed, stretched, but you will also be supported, coached, educated, and you will feel the satisfaction of helping others to achieve their potential as you move towards fulfilling yours. And you will realize that you chose a vibrant, meaningful, personally enriching, and satisfying career. This is the mental health team. I'll let you read through those for a second. And it's important to note that all of your lecturers for nursing subjects are nurses or midwives first. And then we have moved on to become doctors or whatever as well, but just important to know that. Supports. Well, UCD is a massive university, and university can seem a bit overwhelming at first to some students due to the enormous campus and the diversity and sheer number of students. But we recognize this, and there is always support available, such as we provide an orientation, we connect people with peer mentors, you will be assigned personal tutors, student advisors, clubs and societies and student welfare services are all available on campus. So make the best of your orientation, join in everything, introduce yourself, and begin to make new friends. What does UCD have to offer for undergraduate students? Well, I mentioned some of them there, but in addition, we have all kinds of things like healthy eating options on campus, opportunities to get fit. We have the most wonderful gym and a 50-meter swimming pool. We have so many clubs and societies, and of course, there's the Students' Union. So what's healthy UCD? Well, it's about being connected. It's about being active. It's about availing of help and support or offering help and support. It's about learning. It's about being healthy, eating healthily, being mindful, and sleeping well. Further information can be availed here. So thanks for your attention. If you want to post any questions, do pop them into the Q&A there. Thank you.
Thank you very much, Peter. I'll have a quick look and see if we've any questions related to mental health nursing. And I do that by... Sorry, Justin, I don't know how to get the questions public. They just seem to, oh, there we go.
Okay, there's one there. What kind of career options are available with the mental health degree?
Okay, so I think my colleague Suja has beautifully covered this already, but there's basically about 2 or 3 streams. So one is that when you qualify as a staff nurse, you can get some experience as a staff nurse, and then you can move into the management stream. So you can become a clinical nurse manager grade 1, clinical nurse manager grade 2 after time, a senior nurse manager, assistant director of nursing, and eventually director of nursing, where you're running a big hospital, or even an area director of nursing, where you're running a large service across sometimes many hospitals. Another stream would be an educational stream, where you're moving into like a personal tutor, or perhaps moving into a university environment where you're becoming a lecturer. Obviously, that will involve further study before you can get there. And a clinical stream is where you look at becoming a clinical nurse specialist, and that can be in addictions, in eating disorders, or in any of the specialist placements that I've mentioned, like psychosis and so on. And then from there, you can move on to becoming an advanced nurse practitioner, which is like a nurse consultant, where you're able to see your own patients, decide on their treatment and care protocols, and basically carry a full caseload. Hope that answers the question.
Okay, thank you, Peter. So there's a couple of questions that I can probably type answers to afterwards. But could the course be triggering if mental health has been an issue in the past, Peter?
Yeah, it's really important just to be aware of your own mental health. So, for instance, if you are somebody who has suffered with an eating disorder, or you may have suffered with an addiction or whatever, it's really important that you notify us of those conditions at some point if you feel that you can disclose. That would be simply in order to try and be aware of your needs if you're on a specialist placement, because it could trigger if you've had an eating disorder and we don't know about that. You don't have to disclose anything to us. And then you're working with young people, adolescents who maybe have an eating disorder, and it could stir things up for yourself in that matter. It's not to say that you have to avoid taking on mental health nursing if you've had something like that. If you've recovered, it's absolutely fine, but it could be challenging.
Thank you.